Thank you, Erica.
Hello, Supervisor.
Supervisor Altringer is on the line.
Thank you very much.
Thanks. Okay, Dutch. Come on up and
Good morning, everyone. Thank you for the opportunity to be here today. I appreciate it.
absolutely.
Director Mumm sends his apologies. He sent me a note about 8 o'clock last night and no longer has a voice. So he's no longer allowed to go on vacation because every time he does, he comes back with something and it's not good. So. But thank you again for having me. I'll go through the slides that we have today. Please feel free to ask me any questions as we go through. Whoops, I'll try not to go through them that quickly. As you can see on the slide, the first slide, we had an estimated revenue this year of 1.19. million for our upcoming year. Our requested expenses for this year are 1.222. Right now at Emergency Management, we have 7 employees, 7 full-time employees. We've supplemented that with volunteers and others throughout the year. This is as we projected coming up into the year. We do have an estimated revenue that varies a little bit from what it was last year. We have an $81,000 additional contribution. That's because we added the resiliency officer to our staff last year. We have an adjustment based on our hazmat payments that we normally receive. We expect that to be reduced this year. Our budget that we had last year was $35,000. A more realistic number is $25,000 for those revenues. So that's why that's a decrease of $10,000 on that. Our estimated expenses, as much across the entire county, we expect to see an increase based on our personal services, and that increase is $53,000. We do have an additional expense on our hazmat. We have a contract with Des Moines Fire Department that controls our hazmat services. Much like us, they are facing some personnel increases, so the contract is increased, so that's going to be an additional $40,000 this coming year.
What does that contract cover?
It is for any of the hazmat services. So they actually have a hazmat certified team that when we do have spills during the night, things like that, that hazmat team responds to anywhere in the county. It's not just Des Moines, but it covers all of Polk County. So they handle all the hazmat response, cleanup, things like that, that aren't covered by those agencies or organizations that cause the spills. So,
Do other communities participate in the cost of the contract, or is it?
that I can't answer, Supervisor. I know that the contract that we have covers our portion for Polk County.
Okay.
I know that they will respond outside of Polk County, and I'm assuming that they have similar contracts with those other counties.
Okay.
This is our emergency management team. You all know Director Mumm. He provides our vision and our mission for our agency. Cameron Stuffelbeam is a program assistant. He's been there quite some time now. Cameron covers a lot of those hazmat contracts that we have. He's also responsible for resource management, identifying resources, locating those things during disasters. Patty Nordmeyer, you probably all know Patty. She is the face of our office when we come in. She organizes all of the chaos in our office, handles the rooms and things like that. As Deputy Director, I fill in for Director Mumm when I get those last-minute calls that he's not available, but responsible for a lot of the planning that we do and the special projects that come up, and we'll talk about some of those in just a minute. Brett McIntyre will join the team in 2023. Brett is our training and exercise officer. He works with multiple agencies throughout Polk County to do training exercise programs, testing the plans, revising the plans as necessary to make them more compatible with how people respond. Laura Kaser is our resiliency coordinator, and Laura has taken over kind of our mitigation planning as well as the recovery plans that are now a requirement from the state. So Laura has been here since 2023 also. She has taken charge of the recovery plans. She's working currently on an infrastructure recovery for any type of disaster, coordinating those things with our private sector and government agencies. Our newest employee is Lynn Tazioli. Lynn is, she's been around the dispatch centers and things like that in Polk County for quite some time, but new to our agency. She's taken over as the 911 coordinator for our office. Recently, we adopted the fiscal responsibilities for the 911 Service Board. So Lynn is taking over the fiscal responsibilities. She's also a part of the 911 Service Board for the planning, for the organization, for the meetings that are required there. She is responsible for emergency support function number 2, which is our communications, emergency communications for the county. And that's our team. A very good team, very seasoned team. They've been wonderful to work with over this past year, and you're going to see some of the successes that we've had. Some of those things, the recent accomplishments, you all remember the tornadoes that we had last spring, and a big part of that was response to tornadoes that started in April. continued through. I don't know that I've ever seen as many tornadoes come through Iowa in history. We had 124 total in Iowa, but 4 that actually touched ground in Polk County. So you all remember the ones that went through, starting in Johnston all the way up through Elkhart. Pleasant Hill had a repeat of a year ago where they got hit again. So the response to those things, as you can imagine, takes a lot of extra time and effort with our office, with our response, and the opening of the Emergency Operations Center and those types of things. I mentioned the 911 fiscal policy. The development of that has actually solidified the actions and steps that need to be taken so that we're following an actual policy on how things are handled with the 911 Service Board. It's been well received by our public safety answering points, our dispatch centers, so we are operating under an actual policy now. Special events are a big part of what we do as well. So we respond to any request for special events. You've seen things like Ironman, the Iowa State Fair. We handle the, I just drew a blank, Pride Fest is a big partner with us now. We've done the food thing down on Court Avenue. We've recently adopted those guys as partners as well, so we are developing their incident action plan, event action plan for how they respond and how they develop safety and security issues for that. So a lot of effort goes into, we had 17 events last year. We actually expect to see that bump up again this year a little bit, so a lot of effort goes into those. We had a really big success with our active threat work group this year. And the active threat work group, as you can imagine, is a big part of law enforcement response, but it also requires coordination of our fire departments, our EMS, folks like that that are all partnered in a cooperative response to an active shooter. We've had a group together for about 5 years now, 6 years now, and we've never actually been able to test that entire group. We had a really big success this year in which we tested 16 different agencies that we brought together out at the Prairie Meadows and had a full-scale exercise responding to an active shooter event. We were able to run through multiple scenarios with those partners. A very big success. We found a lot of gaps in communication, gaps in response that we're able to adjust the plans, fill those gaps, and have a better response to an event like that. Our countywide hazard mitigation plan, that was updated this year. Our hazard mitigation plan has been very successful. In past years, that's actually brought tens of millions of dollars into Polk County with those efforts that we've had with reducing our hazards by mitigating those things. We expect the plan next year. We're looking forward to possibly a combined plan with Dallas County, so that we've got a cooperative response that's actually interoperable with those guys as well. So good news to come as far as the mitigation planning goes. The fact that we've got a plan in place qualifies us for those planning grants. Planning efforts coming up, we have our emergency response plans, our emergency support functions that we're doing, and our recovery support functions. We did 6 last year. We're doing an additional 5 this year as an update. We have lunch and learns, monthly lunch and learns. We'd love to see you all come to those. We had things like artificial intelligence, active shooter response, partners with reunification planning. All of those were part of our lunch and learns this past year, and we expect to see a lot more success this year. Annual Joint Chiefs meeting allows us to get together with all the fire, police, and EMS chiefs cooperatively and have a discussion. Some of the things that come out of that help us shape programs and policies, procedures for the upcoming year. We have a CAD-to-CAD project that we've been working on with a number of partners. As a matter of fact, we brought together over 250 people to help coordinate and organize the CAD improvement project. A CAD is computer-aided dispatch. Speaking in acronyms again, I'm trying not to do that, but we've never been able to have, we've had 2 different systems in Polk County. Right now, we've got us to a point that all of our partners at our PSAPs, our public safety answering points, can see each other's calls, which is a great place to be. It's a lot more informative. We don't have to rely on phone calls. We can actually see those real time as they happen. We are right now in the testing phase to try to get to a point where we are unified. And unified means that with the cooperation of the agencies, we can actually dispatch people from other agencies or outlying areas to the calls if they're the nearest unit. So we've worked through a lot of the policies and procedures that will allow that to happen We expect to see that once the system's in place. We're going to run 2 test pilots over the next coming 6 months. And then once that's in place, we'll be able to dispatch nearest units to any incident that happens in Polk County. We were awarded this year. Catch Des Moines recognized us for a lot of the partnerships and those planned events that we do, and I talked about those a little bit already, but Catch Des Moines gave us the Community Champion Award this year, so that was a big honor for us to receive that. One of the programs that happens out of our office is we run our duty officers, and our duty officers are responsible for responding to calls 24/7, 365. So as you can see, there's been a steady incline since 2020. Last year we had 139 responses. Many of those were fire calls that happen all times of day and night, as you can imagine, multifamily complexes. So emergency management's response helps with things like resources, bringing in things that aren't otherwise available to the responding agencies. Part of that is partnering with organizations like the Salvation Army, the Red Cross, to bring in, again, additional support to the residents of Polk County. The division of those, as you can see, fire calls were pretty big. Most of those are single-family residences, but a lot of those were multifamily fires as well. So trying to organize those in a big event, making sure that our responders are cooperative, communicating and all those things is a part of what we do, kind of as a behind the scenes. A little bit about our allocation time. You can see the administration bar that takes up a lot of time and hours. Administration's a really broad category. A lot of that is recurring meetings that happen, partnering with our organizations to find out what their needs are, those types of things. Communication has actually taken a leap. That's been our number 2 time consumption right now. That is a lot of the CAD to CAD project, and what we see moving forward is a CAD improvement overall for the entire district, the entire region. Planning, training, education, all of those are part of what we do at our organization. We have a lot of near-term and long-term upcoming events. We have our partnership meetings coming at the end of the month. We'd love to see you there. We are developing a commissioner's handbook, which as we come in with new commissioners, new elected officials, this would be something that we could give them to give them a little bit more background on what emergency management is and what we do. We have a field operations guide that we're going to try to produce digitally so that our responders have access real time to those emergency support function and what the expectations or roles and responsibilities are for all of their organizations. Planning, obviously that's going to be an ongoing effort as we work on an additional 5 emergency support functions and recovery support functions. Training continues nonstop, and we have polled all of our partner organizations to find out what their needs are this year and make sure they fit with our emergency support functions. Exercises is how we test the plans and make sure that we're rolling things in, updating as we need to do. Response and recovery, we're hoping that that's not necessary this year, but unfortunately that's the expectation when we live in Iowa, is that we're going to have responses. Long-term, some of the things that we're looking at are the 2080 agreement. You saw that communications took a big leap this year in the amount of time dedicated to that. So we're going to review that 2080 agreement that we have with the 911 Service Board to see if there's a better fit. Right now, it's a very small portion of what's dedicated by the 2080, but in reality, we're spending a lot more time on that than we have in the past. The active threat work group will continue to grow, train, bring in additional officers, bring in additional firefighters to that group so that we're better prepared in Polk County to respond to an active shooter incident. We're looking at that CAD to CAD project. A couple of things that came out of the project itself were the need for a common CAD, and that was through the strategic plan that was developed, as well as a needs analysis that was done by one of the companies that was contracted as part of the project. We've identified that a common CAD is a good solution. Obviously, there's always going to be a funding source needed for those types of things, but looking at the transition, how we can move into that in the future is going to be a part of what we're looking at with that group. One of the things that we've identified through the meetings with the chiefs is the need for an incident management team. And if you're not familiar with incident management teams, that is a group that in a long-term event, if we have something that exceeds several operational periods, it's hard to get relief for some of those positions, either in the Emergency Operations Center or with Incident Command. The IMT would be a team that can come in that can fill those positions over many periods or many days as the incident continues. So we're looking at how to coordinate, facilitate, and organize an IMT within Polk County. We talked a little bit about the mitigation plan with Dallas County. That would be a step forward for all the areas, especially when we talk about those larger metro areas that include places like Norwalk and Waukee and areas that extend past Polk County's borders. And lastly, the Des Moines Metro Healthcare Coalition. That was something that was proven to be very effective during COVID. We've continued the coordination organizations with those organizations. Laura, that I mentioned earlier, is leading that healthcare coalition, so we expect really good things to come out of those with the planning efforts that we have now.
Excellent. Questions for Dutch?
Excellent.
I think you guys do a great job. I've been out on a couple of the disasters and watched you work in real time. And it's good work that you do out there. When you talk about the 28E analysis,
Yes.
what are you thinking?
We have to sit down and actually look at what is currently being paid for and how that compares to the hours that we're spending on it. And we haven't done the analysis yet, Supervisor. It's something that we really need to look at, though. We know that the time being dedicated, the initial 2080 covered just that position of the 911 coordinator, but frankly, the hours that we're spending are hours of mine, hours of AJ's, that we really need to look at how that plays out. We want to be fair to those folks that our Emergency Management Commission, the Board of Supervisors, and others on how we're actually spending our hours.
Gotcha.
Yep.
This is Jill. When you talk about the 2080 agreements and then the TAD would be better if it was a common TAD, is that part of the 28 agreement?
That's actually part of the study that we did with the CAD to CAD project, and part of that was a needs analysis that came out of that. The needs analysis identified that a common CAD would give us more cost efficiencies and some interdependencies, I guess, that need to happen in order to have effective communication. So it's separate from the 2080 discussion. It's something that's been identified as a need, so trying to look at where we can pay for that or where it could cover those costs is going to be probably a separate independent look.
And what kind of cost are we talking with that program?
It can be anywhere. The needs analysis that came back showed us costs that ranged from roughly $13 million to $20 million. So the cost is substantial.
Thank you.
Yes.
Any other questions? Thanks, Dutch. I appreciate you being here today, and thanks for your good work.
Thank you very much.
Morning, Josie.
Good morning.
How you doing?
Good. Josie Lewis, HR. Before I start, I'd like to do a few thank yous if I could. So I want to thank our whole HR team. So my second week was when I was given the budget to prepare for the upcoming year. And our entire team has met in department meetings, has met in one-on-one meetings, especially Jody and Keisha, who are here today, to really work on this together as a team. So I very much appreciate all their support. And I'd also like to say thanks to Deb and Sarah and Shelley Poole, who is in Deb's office. They have dropped everything to explain numbers to us, help us understand what's behind those numbers so that we really understood them and were able to put together the line item budget in today's presentation. So huge thank you to all of you for helping. So I'm gonna jump in with our slides for today. Oops, or I'm gonna mess it up. Okay, so for our department, our estimated revenue is $50,000. For you, those of you who've been on the board before have probably seen that number. That is an insurance reimbursement number that's been in there for several years. That's always plugged into our budget. Our expenses are right under 10 million, and we have FTE of about 17.9. Those 17.9 full-time equivalent support 1,676 employees throughout the county. Throughout our presentation, and when I talk about our goals today, you're gonna hear me talk a lot about recruiting and retaining. High-functioning HR departments do two things really well. They recruit and they retain the employees that they recruit. And so a lot of what we do is making sure that we're doing that at a very high level. And so when those employees that you see that are part of our department are supporting everybody in the county every single day. So we have one budget or one decision package that I'll talk about here a little bit more. It's tied to our insurance premiums increase, and that I'll talk about here on the next slide. So we have a small decrease in our budget for the year, and I want to go into these numbers a little bit more. The COLA and those numbers you've seen on other slides, but I want to talk about these next two numbers. So our adjusted retiree insurance estimate. So that is money that is spent based on when employees retire, their sick leave is used to offset their insurance costs, and that number is decreasing a little bit. We're having some retirees fall off of that. We'll watch that number pretty closely over the course of the year to see if there's any changes. If there's an increase in retirees, that number may adjust. But for right now, that's what the number is when we did the snapshot of the budget. Then we had a one-time appropriation last year for Project Iowa, which supports interns that have been in the county. That was a one-year grant that we received. We still have some money left over from that grant that will be used to support interns in the upcoming summer and throughout the year as well. And then our decision package. So this is an insurance increase. Jester Insurance recommended a 12.9% increase. We have added that into the budget. The exact number is $219,709. And that is based on our annual increases over the last few years. So that comes in, they said between, I think 11 and 15% was what we were told, and they recommended 12.9. So that's what we've plugged in. Matt, did you have a question?
Yeah, so that 12.9% is an increase for what type of insurance?
Our liability insurance,
So it's all property casualty,
yes.
and we self-insure for a portion of that.
Yes, is it 2 million? I'm gonna have to get you that
Okay,
number.
Okay, all right,
Yep.
thanks.
Yep. Okay. Now I get to talk about the fun stuff. So recent accomplishments from our department. So our department, during one of our meetings, went through and had everybody write out on sticky notes all the things they've accomplished in the last year. Way too many things to put on one slide, but we've narrowed it down to a few key areas that we want to highlight for the board. So cost savings and efficiencies that have been created through some of the decisions that have been made. So want to highlight a couple of these. Risk management the board approved a contract back in November for Rising Medical Solutions, which is a medical bill review that we use for work comp. So they take a look at our bills and see if there's places that we can save money. And this was shared previously with the board, but since May of 22, that saved a little over $800,000. So by making sure that we're using some of the same processes and procedures, we can generate some of those efficiencies that we realize in real money in other places. Another thing to highlight is our early intervention program, which our employees can use if maybe they're having back problems or things where they're starting to notice something that's going wrong. They can see Athletico, and as part of that, then get some help early on so it doesn't lead to work comp claims later on. In terms of software programs, we have switched to UKG, which manages our leaves. And so it's more streamlined approach across all systems, or all departments, I mean, so that we can really track that on a, minute by minute basis as people are entering that and have a good idea of what's going on. In our own department, we are using Smart Sheets, which allows us to collaborate in the same document so that we can track. Right now we're tracking our trainings and some things that we're doing, so we're able to collaborate more easily within our department. And then employee engagement. So when I said that two things that HR departments do that are if they're doing a really good job is recruit and retain, employee engagement is how we retain our employees. And so stay in the loop. If you've received those emails, it's really communicating with all of our employees, consistent information. We've also engaged in cross-department work. So, for example, at some of our community engagements, various departments would all buy a booth. Now we're condensing that so that we're buying one booth, not spending out of multiple places. And then things like MLK Day. I don't know if any of you went and did Meals from the Heartland. I did that on Monday. Our group was very efficient. We did not take the whole hour and a half. It was like an hour and 10 minutes because we were so good.
Competitive. You're competitive.
Very competitive, and nobody talked. We just got right to business. So just ways to keep our employees engaged and wanting to come and work at Polk County every day. The compensation study, as you all know, was completed in 2024. Previously, that last comp study had been done in 1984. So the comp study was meeting objectives set by the board in terms of having all of our employees at that 70th percentile or above, which the comp study accomplished. Another one is changing our open enrollment for benefits to the fiscal year and the calendar year. This was just an alignment of our plans and our open enrollment all being on the calendar year. So as of January 1st of 2025, open enrollment and all of our plans align, which is really exciting. It makes things way easier for tracking. So I want to talk next about our upcoming opportunities and considerations. The first three bullets on this slide are our department goals for 2025. These are aligned with the board's 8 core values, specifically the first one that talks about the county's greatest asset being its employees, and that we are here to encourage and create opportunities and resources for every employee to meet their maximum potential. So our team worked on creating these 3 goals, and then all of our work for 2025 is going to be anchored to these. So we want to create learning and development for employees across the board. What is the standard that we want to set that we expect all employees to be trained and be able to do? And then what do individual departments need to know and be able to do? So that's going to be a big goal. We've started working on that already, have a couple dates already set for us to communicate some HR 101 learning with supervisors, and then some other training that we think would be beneficial. We also want to work on our HR processes and procedures, making sure that we're efficient with that and we're not setting up barriers that make things harder for our employees to access the resources they need. So we're going to keep working on that and make sure that we keep getting better every day. And then increasing employee participation and engagement. Again, making sure that our employees want to come to work every day, want to work for Polk County, and creating opportunities for them to engage with their coworkers and with the community. And so when it comes to any goals, you kind of wonder, well, how are we going to know if we are meeting these? Our team is setting up project teams with each of these 3 goals, and then we'll have standards established in each of them so that we'll be able to measure how we're growing towards those and whether we're meeting the goals we've established and need to make adjustments or anything like that along the way. The last thing I did want to highlight, because it's going to be a big push from our department, is we'll be issuing RFPs. Particularly, those RFPs are going to be for health insurance. So we're going to have, right now that would be Wellmark, Delta Dental, Delta Vision, and Voya. So those RFPs will be coming up in March. So I wanted to highlight that for the board, as that will be a big consideration for us and for all of you when we get those RFPs back. Long term, we want to look at employee data. We want to be able to pull data, be able to use data from which to make decisions, and then, you know, if that comes back to all of you or our department needs to make decisions, but we want to have the data at our fingertips to be able to make some decisions. So with that, is there any questions for me?
Tell me about your RFP process and how that will work, and who's going to run that process.
Yeah, so we're engaging with a third-party vendor to help with that, who knows the ins and outs of what needs to be in those RFPs and could help us evaluate if it's the responses to the RFPs meet what we're asking for. So that'll all start here, I want to say the first part of March, mid part of March.
Okay.
But we'll rely on that
Have you
vendor.
selected the third-party vendor?
I believe we have. I believe it's Holmes Murphy.
Okay. Okay. And these teams that you're gonna put together, tell me about the,
Yeah, so our project teams are department meets for department meetings, and they've all selected into which area they want to work on that they think most impacts their work. Some of our team members are on multiple teams because there's lots of work that touches on all of the things they do. And so they're going to work in those teams to identify SMART goals. So how can we measure if we're, meeting our goals, and report back each month to our team, and then we'll make decisions from there.
great.
Yep.
One of the things you mentioned was retention of employees, and I share your desire to retain employees. Are we working to identify areas where we have high turnover in the county, and do we have action plans established for how to deal with that turnover, or how to identify it and try to get to root cause of what's causing the turnover?
We don't have that information at our fingertips right now. That's information that we can absolutely go in and pull. But the goal really is to have that information for every department, so every department has that information on an ongoing basis. So that's what we're working on when we talk about our processes and procedures, is how to pull that data and then make decisions from it. So retention data would be a big piece of that. Whether that, we have, Keisha, I'm forgetting, what's the name of the survey? Exit survey, and then there's the belonging survey, using all of that data as pieces of the retention.
Okay,
So yes, but we need to pull all that data into one place.
yeah, I'd like to actually see, as departments come forward, if they know their turnover, if that isn't something that they just include with their department request and overview when they come through budgets and say, our turnover rate is X amount this year, or has been consistently, just because I think having an understanding of what's happening in your department is an important part of managing.
Yeah, we could work on that, helping departments come up with that data, and using factors to determine what goes into it and what it's based on. Yeah, we can work on something like
Yep.
that.
Appreciate it. Questions? Any other questions?
Nice job.
Thank you.
Thank you.
Appreciate it. All right. So our next, I guess our next budget session will be on the 28th. It will be board, auditor, and medical examiner, and that will be at 10 a.m. on Tuesday, the 28th, following our board meeting. So, thank you.